Kira saya kung kalau meeting aga. That's mine.
Permana.
Alright, thank you.
Permana. Assalamualaikum.
Assalamualaikum. Assalamualaikum.
Waalaikumsalam, Doktor. Ladies and gentlemen, kindly please turn off your microphone for smoothness of program. You are encouraged to turn on your camera during the session. Thank you for joining us this morning. The event will start shortly. Thank you. Announcing the arrival of moderator Brother Khairul Amri from Kulliyyah of Nursing, International Islamic University of Malaysia, IIUM, fellow speakers Dr. Iman Permana, Magister Kesihatan, Doctor of Philosophy from Faculty of Medicine and Health Sciences, Universitas Muhammadiyah Yogyakarta, UMY, and Assistant Professor Dr. Muhammad Yusof bin Mohamad from Kulliyyah Al Health Sciences, International Islamic University of Malaysia, IIUM. Welcome to both great speakers in today's webinar. Bismillahirrahmanirrahim. Let's begin our session with Kitab Al-Fatihah. Assalamualaikum warahmatullahi wabarakatuh and a very good morning. A warm welcome I bid to Assistant Professor Tan Sri Dr. Normah binti Harun, Principal of Mahalah Fatimah Az-Zahra, IIUM Kuantan Campus, lecturers and fellows from International Islamic University Malaysia, IIUM Kuantan Campus, invited speakers and moderator, collaborators from Universitas Muhammadiyah Yogyakarta, UMY, Program Manager, Organizing Committees, and dearest participants. Welcome to Mirror of Health, sub-program organized by Mahalah Fatimah Az-Zahra Representative Committee 2021 with Nurses Student Society 2021 in collaboration with Universitas Muhammadiyah Yogyakarta. I'm Wan Aini Sahabitu Warsdi, second student from Kulliyyah of Pharmacy. I'm delighted to be a Master of Ceremony for today's event. The audience, for your information, Bureau of Health is a sub-program of 7th International Nursing Summer School by International Islamic University Malaysia, Kuantan Campus, in collaboration with Universitas Muhammadiyah Yogyakarta to share about world healthcare, especially regarding non-communicable disease, and sharing Malaysian culture through an online platform. The audience, now, let's proceed with the most awaited webinar forum session. This forum will be conducted in English. And we feel honored to have Dr. Iman Permana, Magister Kesihatan, Doctor of Philosophy from Universitas Muhammadiyah Yogyakarta, and Assistant Professor Dr. Muhammad Yusof bin Mohamad from International Islamic University Malaysia here this morning with us. So now, without further ado, I'll pass the floor to Brother Khairul Amri to lead this slot. Brother Amri, the mic is yours.
Thank you so much, Sister Aini Nasuha, Master of the Ceremony. I hope I am audible. So taking over, I am Khairul Amri bin Kamaruddin, third year nursing student from IIUM Kuantan, and I'm so honored to be moderating this session this morning. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and welcome everyone to this very exciting forum. And with the title of the beginning figure of medicine in Islam, this forum aims to enhance the knowledge of people regarding the great contributions of Islamic figure in medicines worldwide. So ladies and gentlemen, brothers and sisters, I appreciate if you could make this session to be interactive. However, to ensure the smooth running of the program, please mute your mic throughout the session and you will get that moment to join the discourse very soon during the Q&A session. So before we move on to our discussion, let us get to know to our great and respected panelists who will also be enlightening us on this matter. Our first panelist is Assistant Professor Dr. Muhammad Yusof bin Mohamad from International Islamic University Malaysia. He is currently a lecturer of Kulliyyah of Health Science at IIUM Kuantan Campus and also acting as the coordinator of Islamization of human knowledge of the Kulliyyah. His research interests circling on the subject of tissue engineering and Islamic education. Assalamualaikum, Dr. Yusof. Please say a few words. Please briefly introduce yourself.
Waalaikumsalam warahmatullahi wabarakatuh. Can you listen to my voice, Brother Khairul?
Yes, loud and clear.
Alhamdulillah, thank you very much for the opportunity. So I'm very privileged and honored to be invited by Universitas Yogyakarta and the Mahalah Fatimah Az-Zahra as well as the Nursing Student Society. I'm hoping to listen more to our Bapak Dr. Iman, insyaAllah. So I hope you enjoy for the session, insyaAllah. That's all for me.
Inshallah. So the next panelist is a lecturer from Universitas Muhammadiyah Yogyakarta, UMY, Dr. Iman Permana, Magister Kesihatan, Doctor of Philosophy. He's a lecturer of the Faculty of Medicine and Health Sciences at UMY, teaching nursing programs. He's also very active in publishing articles and joining many conventions, both nationally and internationally in Indonesia. I actually took a glimpse at his curriculum vitae, And his involvement in academic world is so impressive. And one word to describe one word to describe his works is only a variety. So, Assalamualaikum, Dr. Iman. How are you doing?
Waalaikumsalam warahmatullahi wabarakatuh. Alhamdulillah, I'm great. Thank you to be here. Thank you to be invited in this very interesting event. Assalamualaikum, Dr. Yusof, and everyone. Yeah, I hope you are in a great shape at the moment.
Okay, sure. Thank you to both panelists for joining us this morning. Now, about the flow of today's forum, there'll be 3 rounds altogether, and each of our panelists will be asked different questions, and each round starting from Dr. Yusof and followed by Dr. Iman Permana. Our third round will be Q&A session, where we will open the floor to the audience to ask questions. So a gentle yet strict reminder for both panelists to stick with a time of 8 to 10 minutes at most to answer each question. So trust me, I know this is not a competition, assessment, interview, or anything, but we don't want to be chasing time at the end. So let's try to work it. So the first question in the first round, I want to ask Dr. Yusof. In the field of medicine, there are many important figures of the present and the past contributing to healthcare to extent of we get to enjoy the modern and sophisticated technology and ideology in giving and receiving treatment, right? So from your perspective, what is the significance of knowing these important figures in Islam or learning back the history? Yes, Dr. Yusof, please, the floor is yours.
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Allahumma salli ala Muhammad. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Respected moderator, Brother Khairul Amri, Bapak Dr. Iman, and dignitaries, VIPs, students, lecturers, Assalamualaikum warahmatullahi wabarakatuh. May peace, blessing, and mercy of Allah be upon all of us today. First of all, let us express our highest gratitude towards Allah the Almighty. Due to His will and permission, we are able to gather here virtually online. Alhamdulillah. And I would like again to thank for the organizers from Universitas Yogyakarta, Muhammadiyah Yogyakarta, and Mahalla Fatimah Az-Zahra, as well as the Student Union of the Nursing Society. The question was asked pertaining about the significance of knowing the important figures in Islam, or what is the important for us to learn back history, right? Because some says to us, history is the past. Yang apa kita katakan, jangan dikenang-kenang. Kan? The thing is, as in our life, history is a journey. So when we embark in a journey, in order for us to excel further in a journey, we need to look upon the history. Why? There are many reasons for this. Number one, we need to understand the situation of Muslim in our context now. Most of the Islamic countries, if we are putting publication, for example, as a criteria for scientific contribution, we are lag behind. For example, a research mentioned in 1997, one of the research mentioned by Royal Society Atlas of Islamic World, Harvard University alone in one particular year published more than 15,000 papers, more than all of the Arab countries. Arab countries have like 13,444 scientific papers. If we put publication as one of the criteria. Let us talk about Nobel Prize winners. How many are from Muslim contributors? There were only 2 in chemistry. For example, Ahmad Zawal from Egypt in 1999 and Aziz Sanchari from Turkey in 2015. So if we put Nobel Prize winner as a criteria for contribution, then we Muslim are lacking behind. And in terms of government spending, Malaysia, Indonesia, and all of the OIC countries, according to UNESCO, United Nations Educational, Scientific, and Cultural Organization, in 1996, 0.34% of the country been spent out of the gross domestic product income for science. So we can see Muslim countries, the contributions are very less because of the economics, because of political, because of colonization. Because of that, we are losing our identity. We feel inferior. So when we go back to the past, number one, we want to claim our identity. We want to see what are the contribution in the past, so that people won't blame Islam for it. It's not about Islam that we are backward now, but it was due to Islam in the past that we excel so much. With the advent of Quran, when the Quran was revealed, because of the Quran, it transformed the whole civilization. Imagine after 200 years of the Prophet and the House of Wisdom, I will mention this later on, a lot of scholars flourish, studied about Islam. So number one, we need to claim back our identity because there's study been done. For example, one of the good book we can read from Jack Goody, one of the professor of sociology in Cambridge. He wrote a book, The Theft of History. There are certain history is overclaimed by the West. But in order for the West to claim, it must get it from the Islam, because we have a lot of works in the Abbasid Empire. We translated so many books from the Greeks, improvise, add up information, and then become the interpreter to the West, right? But we do not know. We do not know this. So that's why we need to look the past for our identity. The second is that we need to put a proper recognition for our scholars. Let me ask a simple question. What is the oldest university in the world? If you ask the Western, they will say University of Bologna, okay, after the Renaissance. But according to history, it is the University of Qarawiyyin in Egypt, in Morocco. And the founder was a woman, was a lady, Fatima Al-Fihri. So those who claim that Islam subjugated women in education need to revisit this particular idea, because Fatima Al-Fihri in 1859, he bought a mosque. He built up a mosque, and that mosque become an education institution. 200 years after that, then we have the University of Bologna in 1088 AD. So we look upon the past to put a proper recognition. Later I'll mention more about Ibn Nafis. I think many of us know about Ibn Nafis. There's a strong history behind it, but I'll keep it later. I'm not going to mention everything now. Okay. Then the third thing that we can mention is that when we look upon the past, we can reflect and see how discoveries have been made. There were certain theories in the past, but now being criticized heavily. For example, the four humoral theory of Galen, the yellow bile, the black bile, the blood, and the phlegm. In alternative medicine, they use this a lot. I'm not saying this is wrong, but according to modern medicine, after Paracelsus and the advent of European medicine, modern medicine, it seems that this theory has been rejected. For example, let's say you have a fever, you have a high body temperature, they will do bloodletting. They will release some of your blood from your body. It's not cupping, this is bloodletting. Or even sometimes you are going to induce vomiting so that you want to maintain or balance your humor inside your body. This idea was absurd now, but was accepted more than 1,000 years. Even in the advent of Islam in Tibu an-Nabawi, we have some elements of it, although not a total acceptance. Okay? And there were something that absurd at that time, but accepted now. For example, microorganism. In the past, there used to be a thing that environment, the polluted environment causing the problem. But the idea of small microorganism, although be mentioned by Ibn Sina in kind of medicine, but it was considered as absurd because no one can see until the advent of microscope by Leeuwenhoek, right? Where you can see this particular small microorganism thing. That's why when a cholera outbreak in Britain in 1847, John Snow, when he proposed that cholera is due to the water pump in the city of London, a lot of people or municipal council at that time did not agree with him. They thought it was because of the air, not because of the polluted water content, though they did not know what actually inside specifically. So when we're looking at the history, we are observing something that considered absurd in the past but accepted now, something that considered absurd now but considered one of the greatest story in the past. So we learn people how they do discoveries. And the four things that I want to mention is that there were some lost technology that until now not known. It's not pertaining to medicine alone. We can have, like, for example, in the Greeks, they have the Greek fire. When they attack the Persian Empire, they used the Greek fire. With this Greek fire can even burn inside water. Now, chemistry has so advanced, they can even try to figure out what are the components, but do not know what the composition. It become lost forever, right? And even if you watch National Geographic, there's one series of lost invention and technology of the past. So by looking of this, we're going to appreciate more. So as historians always say, history keeps repeating, but with different characters. So when we learn about history, we are going to excel further. We are not move backward, we are moving forward. Inshallah, that's all for now. Inshallah, I return back to moderator.
Thank you so much, Dr. Yusof. Okay, so here we get, I believe we get 4 points. So, but there's a remarkable phrase from Dr. Yusof, how life is actually a journey, and history is a part of history is part of the journey. And by looking at the past, we can actually help us to bring us forward. So, the 4 points that I got is the first one. Why is important to learn these figures? The first one is to claim our identity, because a lot of factors that slowly fade the presence of Muslims contributors or whoever who had contributed in the past in this industry. Second, we want to give them proper recognition. Even in our research, we might want to cite other people's work. We want to give recognition to them by using their putting it on our reference. And the third one, how discoveries are made. Things might be absurd in the past, but might be accepted in the current time. So vice versa. And the last one, we might want to by learning history or by knowing these figures, you can appreciate more and excel further in our life. So thank you so much, Dr. Yusof, for the answer. And next one for Dr. Iman Permana. Travel back to history again. So when was actually the knowledge in medicine starts to flourish, to expand? And we know that it must be evolved due to researchers and efforts of these big brains or scholars. Do you know who they are, who had largely helped and contributed to this investment? So please, Doctor, the floor is yours.
Okay, thank you, Brother Amri. I hope you can hear me well, because I'm sorry I'm still wearing my mask because I'm working from my office. So it is very interesting issues, and I think Brother Dr. Yusuf has already explained about the history, and then it is true that what we can learn from history, that we can learn to do better, to excel in the future. We cannot just let the history pass, just praise it, and then let him just drift away without learning anything from it. So if we are talking about the history of medicine in Islam, in Islamic history, I believe that we agree that several authors mentioned about it and wrote about it. It's about in the earliest as the 8th or 9th century, right? If you I've looked for several sources, and then I found that if you look back to the history, it is maybe began with the establishment of hospitals in Islamic world. Yeah. It's called Bimaristan in around 700 CE, right? So it is first built in Damascus, and then it was served as a basis of medical education as well. So it's in clinical practice. Okay? And then by that time, medical education was done, and lecturer in masjid, and then they do clinical practice in Bimaristan in hospital. So I think what they've done there is already made a standard for the medical education as what we've seen today. Yeah, and then also they also established licensure for every physician. Yeah, so in that time, every physician that needs to do practice has to pass a licensing process, which is a very, very interesting for me up until now, because it is quite remarkable for me because it is what we've done so far in the modern of medicine, right? So if you ask me about the figure, the prominent figure of medicine figure, I think we cannot, we have to remember a few of them, yeah, many of them, but the most prominent for me, maybe the first one is Ar-Razi. Maybe you agree with that. Ar-Razi lives around 9th century, yeah. He was born in Persian, yeah, somewhere in Persian. He's not only physician, but he's also a philosopher and scientist. Okay, he's written many books, yeah, including the most prominent book is the book on medicine dedicated to Al-Mansur. Yeah, Al-Mansur is one of the Khalifa, yeah, at that time, and that Khalifa was appointed Ar-Razi to be the head of the Bimaristan, of the hospital. And then Ar-Razi wrote the book specifically designated to Al-Mansur, the book on medicine dedicated to Al-Mansur. It is the one of this book. Yeah, the book describes various medical illnesses and therapy. Yeah, and this book also used for many centuries in Western university afterwards. It was translated to Latin, yeah, and then also used in Europe during the Dark Ages. Yeah, and then he also wrote many books. Also, the most important thing for me, I think, it's about the book about spiritual psychic, yeah, Atib al-Ruhani, yeah, focus on spiritual and psychological medicine. Yeah, well, it was translated to many languages. So I think Ar-Razi is one of the prominent in the earliest day of medicine in Islam. Yeah, and interestingly, Ar-Razi also has established a system in clinical trial. Yeah, clinical trial where he made an experiment based on two groups. Yeah, it's about bloodletting. Yeah, the effect of bloodletting on a condition. Yeah, so he divided the patient into two groups. Yeah, where the first group is a case, and the other one is the control groups. Yeah, so it is very much similar. Who we already familiar with nowadays. Yeah, in this modern of medicine. So I think if you go through his works, I believe, oh yeah, there's also his work about variola, varicella, yeah, and it is very interesting works, yeah, that this work has been learned by many of Western countries' physicians, yeah. And also, another prominent scholar from Islamic world is, of course, Ibn Sina. Yeah, I think you're already familiar with Ibn Sina, right? Ibn Sina, again, is not only physician, but he's also a philosopher. Yeah, philosopher. That is one thing that interested me the most, is that many of our Muslim scholars is not only scientists per se, but also philosopher. Because I think they based their thinking, they based their learning based on philosophy, on Quran, yeah, philosophy from Allah, from the Islam, yeah. So they based on what is Islam urged them to do, yeah, and then what is Islam has mentioning about the ayah from Allah, yeah, ayah kauliah, ayah kaunia. And that is one thing that I believe has based all these scholars, yeah, prominent scholars, in excelling themselves in medicine. I think that's for me, the Amri.
Thank you so much, Dr. Yusof. So, way how I can summarize it is that the moment or the what we call the moments where medicine, the field of medicine started to flourish was during the establishment of hospital in. I'm not sure the word because I'm not very good at historical and geographical jargon. So and during that time when the licensure was also established and a proper treatment or SOP on treating different patients or different diseases was put. So this is a fun fact, and also the communicator in helping with the initiation of medicine is Al Razi and also Ibn Sina. So just a fun fact, Ibn Sina is also like my idol, or like okay, just a fun fact. So thank you so much, Dr. Iman, for the answer. So actually, I have last question. Something that I'm curious. Like after the first question that I asked Dr. Yusof, said we are still in the first round actually. So for Dr. Yusof, last question for Dr. Yusof for this round. Before, could you share some of the Islamic figures in medicine that their contribution are utilized up until now, and may we know what are their contributions?
Okay, thank you very much. Some of them have been mentioned by Dr. Iman just now. I'm going to elaborate further on that. But for me personally, I more the figure that I really amazed me because Ibn Sina and Razi are giants. Okay, they're giants. Their books have been translated, but there are one unsung heroes that recently in 1924, his manuscript been found in the Prussian Library in Germany, in Berlin. His name is Ala-ad-Din Abul Hasan Ali ibn Abi Hazim, which is Ibn Nafis. So Ibn Nafis, he was the personal doctor of Zahir Baybaras. So those who study history knows the Mamluks are the one who defeated the Mongols. After the Mongols invaded Baghdad, they destroyed Baghdad. So in Egypt, we have another scholar at that time, which is Ibn Nafis. He was the personal doctor of Zahir Baybaras, and Zahir Baybaras is the one who defeated the Mongols at the Battle of Ain Jalut to stop the Mongol invasion. Okay, that's the history part. But the thing is, that really struck me is that Ibn Nafis is the father of the modern circulatory physiology. So the contribution here is talking about body of knowledge, whereby he's the first who described the pulmonary circulation. I know the students know what is pulmonary circulation, because in the past, the doctors were thinking how actually the blood from the right side of the heart goes to the left side of the heart. Galen thought there were invisible pores because Galen did not do any human dissection. It was prohibited in Romans, in Greeks. So he did on animals. So he was thinking how actually the blood goes to the left side. And he put the idea of invisible pores. Ibn Sina didn't comment on it. Ar-Razi didn't comment on it. But Ibn Nafis did disagree with this. He said there's no invisible pores. The blood actually goes to the lung and comes back to the heart. So he described the pulmonary circulation. After 200 years, after that, Michael Servetus in 1514, he actually mentioned about it. Then 200 years after that is William Harvey, right? So these findings is found in the manuscript in Berlin in 1924 by Dr. M. Al-Tatawi. When the topic is Syara at-Tashri. Syara at-Tashri on, he was commenting on Ibn Sina. He was commenting on Ibn Sina. Then after that, after being if you search online, Ibn Nafis has been finally accredited for this. Although some scholars of the West was not really on it because there were anti-Arab contributions in the Italian Renaissance, as if they don't want to, really attribute to the Islamic Islamic contributions, especially in certain fields. For example, in physiology. So Ibn Hafiz also wrote a magnificent book like Ibn Sina, about 300 volumes, called Kitab Shamil. Shamil fi Sina At-Tibiyah. So in these 300 volumes, 80 of them were published. And then people start realizing that Ibn Hafiz might be a surgeon, because there was a discussion whether he did human dissection. Some thought that actually he did surgery. That is why he has this particular idea. That's one aspect. Another aspect that amazed me that he is also a scholar of Islam. I mean, in terms of Islamic jurisprudence. He studied in Al-Masruriyah school in Egypt and was considered as one of the scholars in Shafi'i mazhab. Al-Imam Subki, Tajuddin As-Subki, has a book compiling the scholars of Shafi'i during his time. He put Ibn Hafiz as one of the scholars. And he also wrote a book on Ilmul Hadith. Imagine. So he's a polymath. Not only a scholar in medicine, also a scholar in jurisprudence. So that is the contribution and body of knowledge. Second, in terms of facilities, as mentioned by Dr. Iman just now, that we make a lot of bimaristan, a lot of hospitals. And the hospital at that time was amazed, because in Europe, you do not have this idea of hospitals. You only have idea of private houses. In Islamic hospitals, you have private wards. You have wards according to your disease. You have doctors working in shift. All of these are based on wakaf system, right? Yeah, there's a story. One person, when he went to Baghdad, he saw these hospitals are giving good food and everything. So he like pretending to be sick. He entered the hospital and doctor knows actually he did not. This person is not sick, but doctor allows him to stay for 3 days. Because in Islam, when you want to greet guests, it's 3 days. So after 3 days, and he allows that person to go, because you have a special diet, a special medicine, a holistic approach, not merely on a prescription of drugs. So that's in terms of facility. And in terms of treatment, one of the great contribution of Ibn Sina as well, that it been used until now, is the quarantine that we use in COVID-19. Though this is reflecting to the hadith of the Prophet, but Ibn Sina formulated the Arba'iniyah, 40 days. He's mentioned about the 40 days. Some scholars say he's the first to mention about it. But the idea of 40 days isolation is coming from Ibn Sina, which is now we know quarantine is the simple way of curbing the spread of the virus. Right? Can be done in anywhere, can be done in a simple setting. So this is a particular idea promoted by Ibn Sina. And the concept of ijazah, as mentioned by Dr. Iman, there was a story behind it, where in Baghdad, one of the doctor give a prescription and the patient died. So what happened was that they investigate all of the doctors, more than 100, I think about 800 doctors, because the population of Baghdad is about 1 million at that time. So 800 doctors, they were asking questions like you're having Viva now. Then you give ijazah for you, a license for you to practice. This has been done there at a time during our Islamic peak of medicine. And then Ibn Sina as well has mentioned one thing that really pertaining to the quarantine. He also mentioned the idea of a small microorganism. At that time, they didn't mention about microorganism. He mentioned that body secretions of a host organism contaminated by a tainted foreign organism, not visible by naked eye. So the idea is there, but he couldn't see that because there's no microscope during that time. Okay, the idea is there. And the third scholar that I want to share is Az-Zahrawi. In UAE, we used to have mahalah, right? Name our Az-Zahrawi, Abul Qasis. His main contribution in the field of surgery, they call him the father of surgery. He have a compendium, more than 200 surgical apparatus. Some of them, the Western do not know what is it. Okay, the forceps that we use now, the crushing forceps, the holding forceps, all are actually come from the contribution by Az-Zahrawi. So he also was a polymath. So we can see all of this contribution. But there are side note that I need to mention. I need to mention this is very frankly. Though our scholars like Ibn Sina Ar-Razi excel in medicine, there were criticism in terms of philosophy. Bear in mind. But we are taking them in terms of medicine because the philosophy, because they're importing from Greeks, there are certain ideas being criticized heavily by Al-Ghazali. Al-Ghazali criticized Ibn Sina heavily in 3 of the 20 points. But I'm not going to mention now. If you ask, I'll mention about it. Because I think we are focusing on medicine, right? So we need to know sometimes when we listen, because the atheists are also claiming Ibn Sina and Ar-Razi are from them, which is sounds funny. We claim they are Muslim scholars. We agree with them. The errors are happening at all scholars. That's fine. But we are focusing on the medicine contribution. And as mentioned by Dr. Iman just now about Ar-Razi, when he did bloodletting on meningitis to see, he actually testing Galen's idea. So the idea of criticizing Galen, which is something unknown in previously, was formulated by Ar-Razi. Ar-Razi did not agree 100% with Galen. That's why he did the experimentation. He wrote a book, Shukuk ala Jalinus, Doubts on Galen, which is later on, even Ibn Nafis has that kind of doubt. Later on, Vesalius, the father of modern anatomy, actually he bachelor's thesis is on Ar-Razi. but he did not mention clearly 100%. He did a commentary of a book of Ar-Razi called the Paraphrases, but he did not really mention that Ar-Razi inspired him to criticize Galen. You see, when you read it further, you can find this information. So basically, the contribution can be done in our body of knowledge, facility, instrumentation, and as well in the method of treatment. Thank you.
Thank you so much, Dr. Yusof. That's very interesting. Honestly, I'm a person who is easily to be impressed. These contributions of unsung heroes, or perhaps like the extension of scholars that have been named by both Dr. Iman and Dr. Yusof, totally has taken me out speechless. So without further ado, because if you were to list out all those in contributions, I think this forum will be. So perhaps you can move on to the second round, and this is for Dr. Iman because you might want to give Dr. Yusof some rest. So question for Dr. Iman, we know that every person wants to do something for the community, right? So in this context with regards to Islam, why is it important for Muslims to be involved in the medical field? So welcome, Dr. Iman.
Yes, thank you, Brother Amri. Maybe I want to ask you, why do you want to join the medical field as a Muslim? Yeah, of course.
Should I answer that?
Yeah, sure, if you want to. I just want to know what your answer is.
No, it's okay, Doctor. You can proceed.
All right. Okay. It is very interesting question, and it's a point to raise in front of the students. Yeah, I believe that if you look at the Islamic teaching, yeah, Islamic practice, that if we base our understanding on Quran and Hadith, yeah, there's a lot of teaching, a lot of dalil, yeah, that says about preserving life, yeah, preserving life, not only to human being, but also everything, environmental, what do you call it, plants, animals, yeah, everything that we have to preserve the life, human life. So maybe you're already familiar with the concept of Maqasid Sharia, right? Maqasid Sharia consists of 5 components. Yeah, that first that we have to protect, to preserve our deen, and then the second one we have to protect or preserve our soul, our wealth, yeah, our descendants, yeah, and then also our soul, life, yeah, descendant, and our wealth. Yeah. So that's those are the teaching from Islam, yeah. that has been formulated by the ulama, yeah, that what is Islam has taught us to do. We have to preserve the life. Yeah. In fact, in one of the maybe among others, among the other ayah in Quran, there also you can see from the Quran Surat Al-Maidah, yeah, verses 32, that say that whoever kills one life is the same as killing all mankind. Yeah. On the other hand, if we preserve one human life, it is the same as bringing the whole human life to life. So that is a very strong. It is a very strong what do you call it? Dalil. Yeah, it is a very strong statement that we as a Muslim, yeah, has to preserve life. Yeah, whoever is that. Yeah, regardless of the age, regardless of the religion, regardless of the social economic status, we have to preserve it. Okay. And then also Nabi Muhammad has said in his hadith, yeah, the best of people are those who are most beneficial to other humans. Yeah, you're already aware of that. So I think based on those two, three, we already understand that how Islam, yeah, how Islam is urge us to preserve life, and medicine, yeah, medicine as a field of science, yeah, and practice. Um, I think it's supported that very well, yeah, because we learn how human body works, yeah, we learn how every single detail of our body, yeah, and that's why from history we know that how the knowledge of medicine divided into separate fields, yeah, it just taught us many things about life, yeah. So the more detail we learn about it, the more we know that how precious life is. So I think it's there's nothing. Sorry if I can arrogantly say, there's no religion in the world that has mentioned about preserving life as it is with Islam. In Islam, yeah. I think that's what I can say. Thank you.
Thank you so much. So we can say this Islam and medical field is highly correlated in many forms. Like I'm interested with the Makasi Sharia and the explanation of Dr. Iman. How is it? Why is it important for a person to take care of their own health and relate it to the and relate it to the Islam back? So we also know how the Quran is the original reference for all scholars to refer when they want to talk something about they want to bring some facts, something about medical field. So thank you so much, Dr. Iman. And this is gonna be the last question for our second round. This is for Dr. Yusof. Dr. Yusof, perhaps do you know what are some of the strategies or learning techniques that the past Islamic scholars used to study various fields, and how do we actually try to adapt these strategies in today's generations? So please, Dr. Yusof.
Thank you very much for the question. There are two things in that particular questions. Before we answer that question, we need to understand the position of a student during that time and the student during our time. The context might be different because during that time, becoming a doctor not necessarily going to have a certain jobs. You are doing it, of course, you for the sake of knowledge. You can get a good lucrative job under the caliph, or for the sake of helping people. That's number one. And a lot of students during that time, when they learn about knowledge, they have a wonderful ideas of adab. Students are ingrained with adab, a proper adab. That is why the ethics of learning during that time must be incorporated with adab. As Ibn Sina also mentioned in one of his treatises, in the past they always learn about Quran first, then poetry, then all of other knowledge. Because Quran will enhance the eloquence in speech, right? So if you want to mimic in the past, we must get acquaintance with the Quran. At least read the Quran, though we are not going to memorize it, but at least read the Quran so that we can benefit more and we can have a good heart. So they also have a good intention. When they learn about religion or any other fields, they are having a good intention to please Allah and to help people. That is why they can become a polymath. Not only one field, multiple field. Then, talking about learning techniques. So learning techniques is a bit difficult because our time is a bit different compared to the past. In terms of methods, we can do a lot of methods. Now we have a virtual, right? Virtual. In the past, there's no virtual. They always have the concept of talaki, take the knowledge, a tahammul of knowledge in front of a teacher. And I believe even in our time, especially in medicine, it's not, you are not going to do it in virtually, right? Or in even in the nursing disciplines, or even in lab disciplines. It's very difficult just to watch. You must do it because demonstration, as done in the past, also can be used and even used until now. But we can figure out some of the techniques. Number one, memorization. Those who are studying medicine or any medical field must have the idea of memorization. In the past, Imam Shafi used to say, "In kuntu fil bayti kana al-ilmu fihi ma'i, aw kuntu fi suki kana ilmu fi suki," which means the knowledge is with me wherever I go. If I'm in a house, the knowledge is with me. In market, the knowledge is with me, because he memorized the knowledge. Though in our modern context, we can do a lot of mapping, story, acronym, and etc. But memorization is important. Second, writing. How many of us go to the class and write? Unless we have a photographic memory, right? We used to take notes. Imam Ahmad bin Hanbal, even at the age, very old, still writes, still put the pen on the. Some of the scholars mentioned he put the pen here, for easy for him to jot down notes. Some students say, "Oh, it's okay. I have PowerPoint notes. I have books. I have YouTubes." That's fine, but writing methods is one of the good methods. The third is that discussion. You can have discussion among your good friends. Now you have PBL, right? Problem-based learning. So, problem-based learning, one of the way of techniques we used in the past, even used until now. And then, if you are becoming a scholar and etc., you should embark in writing. You should write, publish papers. This is muhasabah for me as well, because we need to write by papers. But these papers must be peer reviewed. Imam Nawawi rahimahullah, in this book, I will recommend of the students to read this book. I'm not sure whether you can see this. Adab di atas ilmu. This is from Indonesia, from Yogyakarta. Translated in Indonesian. Adab di atas ilmu by Imam An-Nawawi rahimahullah. In Arabic called Adabul Alim wal Muta'allim. 35 ethics of a student, 33 ethics of a teacher in teaching. Very good book. You can find this. So you can learn from the ethics in the past, adab in the past, so that we can incorporate it and we can maximize our learning techniques, so that inshallah we can took from the past and revive our Muslim contribution in science. Thank you.
Thank you so much, Doctor. Thank you so much, Doctor. So I believe some of the techniques that we can actually adapt is like first memorization and writing and discussion. Perhaps I can adapt this to get Dean's list for the next semester. So thank you so much, Dr. Yusof. So that is the end of our the question from me at least. So right now we enter the third round. This third round, before that, before we proceed, I just want to remind, I would like all of the attendees to fill in their attendance and feedback form given in the chat box and YouTube comment section. So for those who would like to ask questions to our panelists, you may type down your questions in the chat box or and I will read for both of our panelists. Or perhaps you want to be interactive with our panelists. You may also unmute yourself. Just hit the reaction button down there on the toolbar first, so that I can get notified, and then allow you to unmute yourself. So please, I open for any audience who might want to ask questions. Actually, with me, okay, I already got some question through my private message. Perhaps this person is so shy. It's okay. I can proceed asking. This is for Dr. Iman. How is the relationship of the medical team in the field of practice, like collaboration or teamwork between doctors and nurses, are practiced in the clinical practice in hospital? How is the relationship of the medical team in the field of practice? Please welcome Dr. Iman.
All right. So the question was how the collaboration between professional, yeah, in the healthcare practice. Is that right? Okay. Thank you very much
Yes.
for the question. It is a very, very interesting question, and then it is highly related with what we call at the moment as interprofessional collaboration. Here in UMY, we also established, we have also established and it's emerged into our curriculum in interprofessional collaboration between medicine, dentistry, pharmacy, and nursing school. So I think if we look at the concept of health, yeah, sehat, yeah, a concept of health, it is also emphasized by Ibn Sina, that health is not only a physical well-being, but also consisted of psychological, yeah, psychological, and also social. It is what we've been familiaring today, yeah, in the concept of WHO, that health is not only physical. So I think if we look at that concept, so we have to integrate our approach, yeah, from various disciplines. Yeah. So it is, for me, it is very, very important to make a collaboration between between various fields in healthcare. Yeah. In order to be able to serve, to taking care, to care the patient. Yeah, because let's say like me, I'm a physician. I'm not really into uh, pharmaceutical, right? So I have to um, consult in regards to the interaction, pharmaceutical interaction, right? So we have to collaborate. We have to make ourselves in a similar position, yeah, to do so. I hope that answers the question.
Yes, I also believe that answers the questions. I think this is a very interesting fact. Dr. Iman said how interactions between every profession is different. They complement each other. So that's why like it is very important for us not to compare between professions, like who is at the top, like who is at the below and everything. So because every profession has their own rules to for them to complete and to treat the patient. So thank you so much, Dr. Iman. Perhaps is there any question from participants who want to talk to our panelists? Want to ask your questions directly to our panelists? So I believe everyone is still shy. It's okay.
Can I
I
ask
see that
you?
I have like, yeah, sure.
Can I
Me?
ask you? Yes, and maybe your fellow students. And I just want uh, to have an insight from your view, or maybe from Dr. Yusof. Yeah? Because we are talking about history, right? How
Yeah.
the great moment when Islam was in the top in history, in medicine, and also in science. So what do you think that we should do at the moment to gain that moment again? I mean, to raise our, to take over again our right, our ownership of, maybe if I may say that, the ownership of the knowledge and science that we had before.
Dr. Yusof, you might want to answer this.
Yeah, I just answer in brief. There's a good question actually. This question was addressed in 1977 in the conference in Mecca, whereby the idea of Islamization of human knowledge, whereby because to talk about this require a 1 or 2 hour lecture. I just summarize it in 1 minute, whereby the secularism, because of the colonization, it caused the separation of knowledge. That is why we need to combine now. A Muslim doctor need to learn about religions, and a Muslim scholars or those involved in Islamic studies, they also can become a doctor. So by blending this, we can limit the idea of separation so that we can revive back the science Islam in the past. As long as the Muslim does not think learning medicine is a secular or is a worldly thing that lead to hellfire, na'udzubillah, or those who are learning medicine who think that these religious people are backward, if this kind of stigma, we're not going to move forward. Inshallah. It's a blending of ideas, inshallah.
Yes, blending of ideas. Thank you very much, Dr. Yusof.
Yeah, thank you so much, Dr. Yusof. As for me, I believe that goes back to the answers that Dr. Yusof has given to us, how the techniques of the past can be adapted in our current generation. Because I can see how it's not like widely practiced, how we are not, like most of the teenagers have to that not many students are respecting knowledge as the scholar used to. So I believe that is the first thing. We need to understand how important knowledge is, and yeah, respect the knowledge and continue with the next step of memorizing, writing, and discussing knowledge. So I think that answer, there is a discussion here. Oh my god, this is so interesting. So anything from the audience? I believe there's a question. So anyone who might want to ask the question, we still have like few minutes left, like very few minutes. Come on, you can ask question.
Assalamualaikum.
Yes, please welcome.
Welcome, salam.
Ya, Pak Iman and Mr. Pak Yusof, alhamdulillah, it's very nice teachings here from both of you. I'm Falasi Ani from UMY, and I want to ask to Pak Yusof. You said before that what adab is very at last time the our scholar was very stressed on adab. So adab comes first before al-ilm. But nowadays I think adab is not too necessary, or not actually it is necessary, but we do not give any apa ya, tidak memberikan penekanan. Pak, sorry ya Pak moderator, tolong diinikan. Jadi di adab pada hari-hari ini tidak terlalu ditekankan kayak gitu, atau tidak tampak kalau ditekankan gitu. Padahal pada zaman-zaman dulu itu adab itu sangat ditekankan gitu. Sangat ditekankan sebelum ilmu itu datang, karena memang yang pernah saya dapatkan itu bahwa salah satu keberkahan ilmu adalah dari adab yang dijaga oleh para murid kayak gitu kan. Nah, cuman sekarang itu kok rasanya agak berkurang ya untuk adab ini. Nah, bagaimana tuh mengintegrasikan atau menekankan kembali adab-adab ini pada pada mahasiswa atau kita sebagai pencari ilmu kayak gitu. Makasih. Assalamualaikum warahmatullahi wabarakatuh.
Jawapan ringkas dari saya ya. Boleh moderator? Masanya udah habis.
Sure, yeah, sure.
Baik, yang pertamanya seperti yang saya katakan, coba baca rekomendasi oleh Imam An-Nawawi dalam kitabnya Al-Adab wal Muta'allim. Try to read the 33 ethics, insyaAllah. And this particular ethics not only by students, even by lecturers, and incorporation in the medical curriculum. So when we have these things, kita mula dari asas hingga akhirnya kita menuju ke puncak. InsyaAllah, over the time, kita akan lihat hasilnya. InsyaAllah. Terima kasih.
We actually have the last questions, and I'm very sorry that I don't want to not entertain this question. So perhaps any of the panelists want to answer this very briefly. So I just read it out for you guys. What do you think can be done to bring the Muslim scholars' contribution and findings into the general knowledge and contribution for medicine, for example, for Muslims and non-Muslim people? So please highlight non-Muslim also. What do you think can be done to bring the Muslim scholars' contribution and findings into general knowledge and contribution of medicines? So please welcome any of the panelists.
Dr. Iman is best to answer this.
Well, I try to answer this in briefly as well. I think we have to base that on what Dr. Yusof has mentioning about adab in IIUM. Yeah. I think we have to learn first about what Islam has urged us to do. Yeah. And because Islam has urged us to do, to give the benefit for human being. So I think if we base ourselves in that perspective, yeah, then it will give us a drive, yeah, to make the best of human being. I think that's it. Dr. Yusof want to.
I think that's a good answer. Nothing to add from me. As Dr. Iman has mentioned, we have a proper adab, proper way of learning, tahammul ilm, and when we practice it, inshallah, it becomes a stepping stone for non-Muslim even to appreciate us. In our history, we have a lot of doctors are non-Muslim. The private doctor to Khalifah al-Muawiyah is a Christian. There are the one of the major translator Ishaq or Hunain Ishaq. Some say he is Christian. So we can accommodate non-Muslim. They also can be part of the civilization.
Thank you so much for the brilliant question and answers session. So I really believe that the audience gained a lot from today's forum. I'm very sorry to everyone because I am too absorbed to this discussion. I really want for this to go on, but we have like time constraint and everything. And by that, we finally reached the end of today's forum. And I would like to express my utmost gratitude to Dr. Yusof and Dr. Iman for sharing your knowledge regarding the topic. As the moderator, please forgive me on any shortcomings throughout the sessions. And thank you, everyone. I will pass back the floor to our MC for the closing session. Thank you to also both our panelists. Thank you so much.
Thank you.
Thank you very much.
Thank you very much, Moderator Brother Amri, and both speakers for today, Assistant Professor Dr. Yusof Mohamad and Dr. Iman Permana, Magister Kesihatan, Dr. Philosophy, for the fruitful and such inspiring session just now. We hope all participants can use the knowledge and output obtained to prepare themselves better in the future. Now, let's proceed with the photography session. I would like to invite Pablo Committee to conduct the photography session. Please welcome.
Okay, hi and selamat sejahtera. So I hope that everyone can open your camera and ready to smile. Okay, welcome. Okay, 1, 2, 3, smile. Okay, another one. Okay. Wait. All right, another one. 1, 2, 3, smile. All right, thank you so much, everyone. I will pass back to the MC.
Thank you. On behalf of the organizing committee, we would like to apologize for any shortcomings throughout the program. Dear participants, Kindly be informed to fill in the attendance and feedback form given in the chat box and YouTube's comment section. We appreciate your help in evaluating this program. Thank you for joining this session and stay tuned for the next slot after this shortly. We will begin next slot, which is game slot, shortly. Thank you.
Thank you again, everyone. Dr. Yusof.
Thank you, Dr.
Thank you.
Ladies and gentlemen, we will begin our second slot shortly. Thank you. Welcome back to the Mirror of Health program. Dear brothers and sisters, this is second session. It's a game slot which will be conducted by the unit module committee. We are pleased to inform you that there will be cash prizes awaiting the winners. Now, I would like to invite the committee from the unit module to lead the session. Please welcome.
Assalamualaikum. My name is Haida and I will be the MC for this game slot. Welcome, dear participants, to How Much Do You Know Quizzes competition. For this first game slot session, all participants are instructed to go to quizzes website given at the chat box and enter the given code on the screen later on. You may then enter your respective name and join the game. The game will begin shortly. Now, as for the rules, you will be given 30 multiple choice questions related to the topic today. Each of the correct answers will give you points. If you answer in a short amount of time for a question, you will gain additional points. Rest assured for those who answered wrong, as you will also be given redemption questions, which mean you get a chance to repeat previous questions that you got wrong. Collect all your points and rise up to the ranking. The highest 3 people will be celebrated as the winners and gain prizes. Oops, special note to the 3 winners, you need to screenshot your ranking as a proof to receive your prize. Now, are you ready? Let the game begins. Congratulations to all winners and good job to everyone. For the winners, don't forget to screenshot your rankings and send it through this QR code. We will announce the winners officially at the end of the event today, so stay tuned. Thank you for joining us and see you in the next game session.
Thank you
Okay.
very
Okay, everyone. Bismillahirrahmanirrahim. Assalamualaikum warahmatullah. Let me introduce myself first. My name is Iman Shahira. You can call me anytime. Just kidding. You can call me Iman, but I call you mine. Just kidding. Okay. So, welcome to the Zoomzilla Guest Arcade. Okay. In this slot, I'll be talking a lot alone, probably, but you may respond to me in the Zoom chat, of course. Okay, so before we proceed with the game, let's read the rules and regulations. Okay, firstly, read the instruction thoroughly. Scan the QR code displayed on your screen, or you can just click the link provided in the Zoom chat to get into the Google Form for your answer. Committee will show the zoom in picture of the mysterious object. 10 seconds will be given for the participants to guess the name of each mysterious object. There will be 15 zoom in pictures of objects needed to be guessed by the participants. After finish answering all questions, then you may submit the Google form. Answers will be revealed at the end of the session. Okay, so everyone, scan the QR code presented and open the Google Form instantly. Open the Google Form instantly. For those who don't get to scan, you can get the link in the Zoom chat. Alright, everyone. Let yourself be ready. Open the Google Form and fill in your details, email, full name, and phone number. Next slide, please. Okay. Okay, I remind again. Fill in your details, full name, phone number, email. Okay. Alright. Everyone, be prepared for the Zoomzilla Guest Arcade. I remind again, you only get 10 seconds to guess. So, get ready for the first question in 5, 4, 3, 2, 1. Okay. Take a guess. Welcome to the Zoomy one, everyone. Take a guess. Okay, choose your answer in the answer sheet. Okay. We have like 6, 5, 4, 3, 2, 1. Okay. Your answer in the is in the answer sheet. Okay. Don't reveal the answer. Just for yourself. Okay. All right. So let's proceed to the Zoomy 2. Let's Zula. Okay. Take a guess. A guess on your own and answer it in the answer sheet. Okay, everyone. All right. Okay. We have like 4, 3, 2, 1. Okay. All right. Okay. Calm down, everyone. Okay. Answer in the Google form. All right. Yes. Sure. Okay. So we're going to the next question. Make sure you have answered 2 questions already because that's in the past right now. Okay. So, okay. Moving on. Let's Zula. Okay. Take a guess what is that? It looks like a camera, isn't it? But I bet there's no camera in the answer sheet. Right. Okay. So zoom out the picture with your imagination and take a quick guess in 3, 2, 1. All right. Okay. Okay, everyone. All right. Okay. Okay. Moving on to Zoom for Let Zula. Okay. I bet you're familiar with it, isn't it? All right. Okay. Take a quick guess on your own. Zoom in the picture with your imagination. Okay. Make your choice in 3, 2, 1. Okay. Good job. Good job, everyone. You have answered like 4 questions already, isn't it? Okay, let's proceed. Let's Zula. Okay. All right. Okay, so what is that? I don't know. Don't ask me. Ask your own. Use your imagination. Okay. Wait for a bit. 3, 2, 1. All right. Okay. So it's going pretty fast, isn't it? You only have 10 seconds to guess. So be quick and be creative. Let's move on. Zoomzilla. Okay, what is that? It looks like a, side mirror, isn't it? Side mirror of your motorcycle, something. Okay, never mind that. Just take a quick guess and answer it in the answer sheet. Okay, 3, 2, 1. All right. We have 10 seconds only. Okay, so let's take a long break here to come down and check your answer. Okay, so make sure you have answered 6 questions already. So let's moving on. Zoomzilla. All right. Okay, what is that? I don't know. Don't ask me. Okay, whatever. Okay. 4, 3, 2, 1. All right. Okay. Thank you, everyone. Okay. Calm down. Okay. All right. Okay. Let's proceed. Let's Zula. All right. I don't know what is that. I cannot think of anything when I look at the picture, but you may do. All right. Come on, health practitioner. You can do this. Take a quick guess. About 3, 2, 1. All right. Okay. We have like 6 more questions, isn't it? Okay. Never mind. We have 6 questions already. You can answer it in the answer sheet. Okay, let's ready. Okay. Zoomzilla. Okay. Wow, what is that? Okay. Let me tell you a joke. Never mind. Next time. All right. Okay. So 5, 4, 3, 2, 1. Okay, all right. Okay. Now we're going for oh, 6 questions, right? Okay, we have 6 questions more, and we're going to the last 6 questions. Okay, Zoomzilla. Okay, you're familiar with it, isn't it? Okay, just find the word of your choice in the answer sheet and yes, make a choice right here, right now. 3, 2, 1. Okay. All right. Okay. We're going fast. Okay. We only get 10 seconds, but I've been taking a bit. Okay. Let's proceed. Zoomzilla. Okay. What is that? It looks like a broom in the first glance, isn't it? The one that Cinderella used. I don't know. Okay. 4, 3, 2, 1. Okay. Now we have like, okay, never mind. We have like, I don't want to count anymore. Okay, let's proceed. Let's Zula. Okay, take a quick guess, everyone. Okay, focus on what is that. Zoom out the picture with your imagination in 4, 3, 2, 1. Okay, all right. Okay, so we have like 3 questions more. 3 questions more. May you got it correct this time. Okay. Next question. Sorry. Let's Zula. Okay, what is that? At first, I thought it's like popcorn in red coloring. I don't know. That's just my imagination, but I don't know what you see. Okay. We're going in 4, 3, 2, 1. All right. Okay. 2 questions more. 2 questions more. Okay. Let's Zula. Oh yeah, right. Okay, I have a joke. Can you hear me out? I don't know. Okay, thank you. All right. Alah, we don't have much time lah. All right. Okay, so in 5, 4, 3, 2, 1. Okay, the last question. Make sure you got it correct for this last question. It may make up for all your answers just now. All right. Zoomzilla. Okay, take a quick guess. I know you know what is that. Come on, challenger. You can do this. This is the last question. Make your best choice. All right. 3, 2, 1. All right, it's submission time. Okay, submission time. So please submit your answer sheet. Make sure you have filled in all your details and answer all 15 questions. All right. Okay. By the time the slide is changing, that means the form is already closed. So take your time to submit. And okay, if you have any problem, you can ask for more time before I proceed to the next. Okay. All right. May the fastest win. Okay, thank you. Let's unveil the answer. Zoomzilla. Okay, the first one. Okay, let's look. Let's reveal the answer. All right, it's a surgical mask, everyone. Okay, so surgical mask. It is also known as medical face mask. It's a personal protective equipment worn by health professionals during medical procedures. All right. Okay, let's go to the Zoomy too. This look like a woodpecker. Let's reveal the answer. It's a Niger. All right. I hope you can get this correct. Niger is a medical instrument used by practitioners to test the deep plunging reflex. Usually, you might see the doctors hit your knee at a spot just below your kneecap, and then your leg kicks out. Yes. All right. Zoomzilla. Okay, the camera thingy. Let's unveil the answer. It's a microscope. It is a laboratory instrument used to examine objects that are too small to be seen by our own naked eyes. All right, let's go. Let's moving on. Zoomzilla. All right. Okay, let's unveil. What is that? It's a medical latex glove. It is worn on the hand of healthcare personnel to prevent contamination between the healthcare personnel and the patient. All right, let's moving on. Zoomzilla. Okay. All right, let's reveal the answer. It is a plaster. All right. Okay. So, do you ever wonder why plasters have small holes? It is to allow for air to move in and around the wound or any sweat or moisture that has accumulated around the bandage to evaporate. All right. Okay. So, Zoomzilla for the next. Okay. Let's reveal the answer for this side mirror thing. It is defibrillator. It is to wake the unconscious, isn't it? It is a device that gives a high energy electric shock to the heart of someone who is in cardiac arrest. All right, let's moving on. Zoomzilla. Okay. All right. At first, I thought it was. Let's reveal the answer. It's a surgical cap. I thought it's like shower cap. But okay, surgical cap are part of medical protective clothing and should prevent germs from the hair or scalp of doctors and nurses from contaminating the operating area. All right, let's moving on. Zoomzilla. Okay, I cannot think of anything. Okay, let's reveal the answer. It is an endoscope. A tiny camera at the end of the endoscope let your doctor to examine your alimentary canal, the esophagus, stomach, and the beginning of our small intestine or duodenum. All right, Zoomzilla for next. Okay, let's reveal the answer. Okay, thermometer. I thought it's like pregnancy test, but okay. Okay, there are many types of thermometer, and it can be seen in hospital, clinics, and premises today. It is to measure temperature or temperature gradient. All right. So moving on. Zoomzilla. I forgot the magic word. All right. Okay, we can see the ECG there. Let's review the answer. Yes, of course, it is the ECG monitoring device, which is stand for electrocardiogram. And it is a simple test that can be used to check your heart's rhythm and electrical activity. Sensors attached to the skin are used to detect the electrical signal produced by your heart each time it beats. All right. Okay, let's moving on. Zoomzilla. Okay, the one I thought is a witch spoon, isn't it? Okay, let's reveal the answer. It is a string. Okay, I bet you know that, even though I tried to cheat on you. All right, string can also can also be used to administer the COVID-19 vaccine. So may I know how many of you are already vaccinated? Please type yes in the Zoom chat. But if you don't want to respond, never mind. All right, so let's move on. Zoomzilla. Infant, uh, uh, okay. Let's review the answer. Oh, it is infant incubator. The one we use when the baby is premature born, jaundice, and have breathing issues and others illness. Okay. An incubator is designed to provide a safe, controlled space for infants to live while their vital organ develop. All right. Zoomzilla for the next. Oh, this popcorn thing, right? Okay, let's reveal the answer. It is a virus, everyone. It is a virus. If it really a popcorn, I really don't want to eat it. Okay, let's moving on. Zoomzilla. Okay, let's reveal the answer. It's pretty obvious, isn't it? It's a wheelchair. Do you know a regular wheelchair can carry up to 156 kilograms? And for users who are over the weight limit, they will need to use a heavy-duty wheelchair for mobility purposes. Okay, let's reveal the last answer, Zoomzilla. Okay, oh my. Okay, it's a stethoscope. It is used, how do we use it? By listening in. And we can listen to the internal sounds of an animal or human body. All right, that's all for this slide. Okay, thank you for joining the session. I pass back to the Master of Ceremony.
Thank you very much to the committee from Module Unit Mirror of Health. We hope that all participants gain some knowledge and output throughout the session. Now, let's proceed with the photography session. Please turn on your camera. I would like to invite Pabur Committee to lead the session.
Hello, Assalamualaikum everyone. Okay, I will give you about 10 seconds to get ready for the photography session to open your camera if you haven't. All right, we will take a formal picture and freestyle. All right. Okay, first for formal picture in 3, 2, 1, smile. All right, freestyle in 3, 2, 1, cheese. All right, thank you everyone. I will pass to the MC.
Thank you. Dear audience, there will be a special slot after this. Hope you guys can stay with us until the end and stay tuned. Dear brothers and sisters, this session is specially created to share with you some of the Malaysian culture. Thus, let's proceed this session with puisi performance from the representative of Fusion of Science and Arts Club from International Islam University Malaysia Kuantan Campus. For your information, he is an active pop performer for IIUM Kuantan Campus. Being the director for Natrah Theatre Performance of IIUM Kuantan Campus, he has been recognized as someone with great capabilities of leading the theatre performance. One of his achievements is he is the director for the Best Theatre Performance in Science Theatre Festival 2018. There are two performances prepared by him today. Now, let's together treasure the beauty of his poem titled Di Sebalik Bendera or Behind the Flag, and poem titled Malaysia, written by M.Kes through the video that has been prepared by himself. Please welcome.
Di sebalik bendera karya Farid Wahabi. Di sebalik bendera terdapat sebuah tanah yang tidaklah seberapa. Umurnya masih muda, masih mentah, tapi tidak bermaksud tanah ini lemah. Tanah yang tidak seberapa ini sangatlah bertuah, melimpah penuh dengan rezekinya. Penduduknya berbagai agama, berbagai bangsa, namun masih tetap aman juga. Masih taat pada Sang Pencipta, masih patuh pada kerja. Di sebalik bendera ini, tanahnya penuh dengan sejarah, padat dengan cerita, kaya dan budaya. Tinggi akhlaknya, kukuh akan perpaduannya. Di sebalik bendera ini, tanahnya sangatlah aku cinta. Kerana inilah tanah di sebalik bendera yang bangga, megah, gagah dan berani, mengibarkan benderanya dengan penuh gemilangan. Di sebalik bendera, tanahnya tidaklah seberapa, tapi sangatlah megah di mata dunia. Sekian, terima kasih. Malaysia by M.Kes. Malaysia, she is the essence of Asia, a heaven of colorful cultures and heaven for food. Malaysia, her land of vast, a blanket of greens and rushing water. Here, the folks of the forest, they sing so harmoniously, lies deeply at the words of peace and brotherhood. Malaysia, a beauty portrays thousands of words. 5 decades of independence, she still stands strong and proud, embraced by the strength of unity, by the people who are believe blood is thicker than fire. Malaysia, her soul is ours. If she falls, we fall. But angels pray as well. She, Malaysia, shall be under the wings of God. Malaysia, our dearest motherland, and we are a faithful citizens. Thank you.
Thank you, brother, for the wonderful performance. We hope the audience enjoy getting to know the culture of Malaysia from the performance. Now, let's proceed with the photography session. I would like to invite Pablo Committee to conduct the photography session.
Okay, everyone. I will give you another 5 seconds to. Can you hear my voice?
Yes, loud and clear.
Okay. I will count 1, 2, 3. Cheese. Okay, another one. Freestyle. 1, 2, and 3. All right. Thank you, everyone. I will pass to the MC.
Thank you. On behalf of the organizing committee, we would like to apologize for any shortcomings throughout the session. Dear participants, kindly be informed to fill in the attendance and feedback form given in the chat box and YouTube's comment section. We appreciate your help in evaluating this program. Thank you for joining this session and stay tuned for the evening slot, which is the debate show between Universitas Muhammadiyah Yogyakarta and International Islamic University Malaysia. We will begin at 3 p.m. for Malaysia time and 2 p.m. for Indonesian time. See you in the next slot. Shall come back with another Zoom link given by the committee. Let's postpone our session with commencement of the Tasbih Kafarah and Surah Al-Nas. You may be dismissed now. Assalamualaikum warahmatullahi wabarakatuh. Thank you and see you in the evening session.